This episode is about a topic not that common in professional Gua Sha, working safely on your own family and your own children. My children actually grew up with Gua Sha, and they often say that they never really learned it. It came naturally. Growing up, it was part of their daily life, like speaking a language or following unwritten rules. They just absorbed it. Much of my life now is devoted to teaching Gua Sha. I spend a lot of time teaching professionally and raising the skills of Gua Sha practitioners in the beauty, health and wellness worlds. I also teach on a community and family level, giving people practical skills to support health and wellness in everyday life. Whenever anyone comes to my professional classes, I teach the techniques and approaches for clients and patients. But I always throw in the ability to treat your own family. And that's the bonus that I'm giving. The ability to prevent ill health in your family for the rest of your life. And I think that's a great thing to know. So treating your own family requires just a little knowledge and technical skill to start you off, especially treating children. Now, the first thing to note is that children are not small adults, and treating them as such can easily do more harm than good. So my goal here is to give you practical, concrete and grounded guidance on how to apply Gua Sha safely for children and bigger children while respecting their tissue, their developmental stage and natural recovery processes. Now, children's tissue is different. A child's tissue responds completely differently than an adult's. Their fascia is softer, their muscles are more pliable, their connective tissue is less dense, and they have a higher ratio of loose tissue to muscle tone. Now, what that means in practical terms is that pressure should be much lighter than with an adult. What feels gentle on an adult can be really intense for a child. Now, the duration should also be much shorter. A few minutes is often enough to produce an effect. And repetition is less necessary. Fewer passes of the tool are needed in particular areas than a bigger person. So practitioners and parents alike sometimes make the same mistake and they treat children like mini adults, but the results can be discomfort and resistance and damage. So when should you use Gua Sha and when shouldn't you use Gua Sha? So knowing when to treat is just as important as how to treat. Now, appropriate situations include, so this is not just a list which is closed. I mean, it's a pretty open list. There are many, many things, but this is a kind of guide for you. So mild muscular tension from, for example, if it's children, they're playing sports or they're on the posture and using their phone too much, perhaps. Restlessness before bedtime is another good one. Minor stiffness and tightness in the neck and shoulders. The beginnings of a cough, a cold, sniffles, mild stomach pains. These are the things that children get. I mean, all children get them. It's such a common thing. And these are the things that Gua Sha can actually be really useful in using in order to help either the pain or the discomfort. Using Gua Sha on other things such as high fever or acute illness or anywhere there's skin damage or there's cuts or there's active inflammation. So in other words, the area is very red and inflamed. And also pain which is not clear and it's got an unknown origin. And that should be evaluated by a medical professional. So what we're not saying here is that you should just treat everything that your children have. It's to use common sense in terms of how you use Gua Sha, because it can be used super effectively when used in the right way. And the basic principle if you're treating at home is that you're supporting recovery and comfort, and you're preventing things from getting worse. So you're not diagnosing or trying to cure or fix the problem, because then you're stepping into the world of healthcare and medicine. Now, if you're going to treat someone with Gua Sha, then it's a pretty high probability that they're going to get redness on the skin, which is something called Sha, which is often referred to in Western medicine as petechiae, which is like little red dots that appear underneath the skin. And this is where blood cells have leaked out of the tissue bed, and the capillaries have kind of opened up and then let red blood cells out and then closed up. And this gives an appearance of like something terrible has happened. In reality, no, nothing terrible has happened, but it just gives the appearance of it because of the red blood cells. There are many of them, and they're quite close together, and so it appears to be some kind of damage of some kind to the tissue. And this is the problem of what it appears like when you're treating children. So if you're going to treat any child, then you've got to be the bridge between that treatment and the educational establishment that that child belongs to. So in other words, if the child goes to school and then shows the wonderful marks, the school has to know what these marks are in order to make the correct judgment about what's happening, because there have been many mistakes. And this is one of the things I teach in my classes about exactly what happened in the various arrests and court cases that have happened in the past. But when I was treating my children, well, I still treat my children, but when I was treating them when they were very young, it was a case of just telling the teachers, giving them a note, using simple communication tools to ensure that no one misunderstands what's happening. And there was never a problem. So let's come on to the stroke technique and the adaptation, which is a little bit different from adults. So the most important technical point is that stroke should be light and minimal compared to adults. And you're gonna treat the areas which are most commonly affected for these problems. So the common safe areas that are going to treat on children is going to be the upper back, so it's the upper trapezius and the shoulders, the neck area for mild stiffness, and that's going to be pretty much the main area. It's going to be the upper back and shoulders and neck, and also coming onto the scalp area. Other areas are definitely possible, but these are the main areas you're going to get most things on. And the technique is you're going to use some kind of tool. Now the tool might be your hand. So if you were talking a very young child, so a toddler, a baby, then this is going to be your tool. This bone of the second phalangeal bone is going to be the main tool, and this is the one that's going to be scraping on the skin. I'm using my face because you can see it, but it's going to be scraping on the skin with your bone. And then you can use other tools, but nothing too sharp. And using a tool is fine as long as it has a smooth edge. Most Gua Sha tools will be fine, or you can use a Chinese soup spoon, but don't use a metal spoon from the cutlery drawer because that's too sharp. And then your strokes are going to be much less. So it's going to be 1, 2, 3, 4, and then that's going to be enough really in terms of treatment. And for a very young child, it's going to be literally just stroking the skin with the tool. And then the older the child gets, the more firm the stroke is. And it's going to be a slow, kind of consistent movement, quite long, and avoiding excessive pressure or speed, because it's just not necessary with the younger children. It becomes more necessary when a child has reached puberty, and then that's going to be pretty much adult treatment. So let's just give you an example. Let's suppose you want to calm down a child in the evening. They're too worked up. And so you're going to come to the head. And this will help a child to wind down. You're going to basically sit behind a child or at the side of them. And you can use the tool. So I'll pick up my tool here. So use the spoon. And I mean, people think that when you do the scalp with Gua Sha that you've got to have some kind of comb, but that's a bit of a myth. You just need a tool. Remember, so if you want it really gentle, you're going to use this bone, and you're going to gently stroke along the scalp. And you're going to head backwards from the frontal hairline, going back towards the occiput, and you're going to keep the pressure kind of minimal, and you're going to just keep gently going from front to back, front to back, front to back, with not with one movement, but you're going to break it down into several movements coming down towards the back. So the goal is comfort and regulation. You don't want to have deep tension release. That's not what we're interested in this case. So that's just an example of how you might calm down a child for bedtime. An important part of treating children is confidence and trust. So children respond not just to touch, but to the environment and the attitude of the person treating. So I mean, if you're treating in such a way that is not receptive to the child probably won't like it and won't want to have it done again. So it's really simple. Just explain what you're doing in very simple, reassuring language. And you're going to keep the room calm with minimal distractions. And, avoid creating an expectation of some dramatic result. It's just, in terms of children, it's pretty much relaxing in terms of treating the standard things you're going to treat. So by approaching Gua Sha in this way, you're building trust and positive association with touch, but you're still being safe. But having said that, children will run away. If you come with a spoon, they might just think, oh no, I don't want to be scraped on my back, and they're going to run away, and that's okay. Happened to my children, still happens to my children. If you have some kind of routine, that would be fantastic. So short, frequent sessions, which are much more effective than really longer, infrequent ones. And if you're observing patterns in posture and stiffness and fussiness about how the child is, then that's going to give you clues about how Gua Sha is working. So this is really important for practitioners because learning to work safely with your own children or the children around you within your family, it gives you sensitivity to tissue response, which is really, really important. It gives you precision with minimal intervention, which is a great thing to learn. And it gives you confidence with teaching with working with different tissue types, because sometimes you're going to treat people who can take a lot of pressure, and sometimes you can't. And in terms of what it gives to parents, it gives them power back, because Gua Sha is essentially all about power and returning power back to and healthcare back to the family unit. I mean, how many parents have come across a situation where the child has got some kind of a mild illness, a slight fever and cough and cold, and they go to the doctor and there's nothing to be done? Well, there is something to be done, because this is what Gua Sha does. And also for, the most common things would be abdominal pain, mild abdominal pain or stomach pain, with any kind of chest things going on. So that means coughs and colds and tightness, upper body tension coming into the neck area, and then head work, which will be connected to kind of calming down the body and reducing the heat coming up to the head, which is creating agitation, and you're bringing the heat down. So in summary, Gua Sha for children is not merely adult treatment. It's actually quite different, and it requires kind of knowledge and restraint about what you're doing. But when applied correctly, it provides comfort, supports recovery, and develops the skill of the practitioner. It's a subtle, powerful tool, but only if executed correctly. Okay, well, that's it for this podcast, and I hope you've enjoyed me talking about treating children. There's a whole lot more, and I've got loads of topics in my podcast, so if you are interested in Gua Sha, go and have a look